Hello, everybody. Hello and welcome. We are attempting to go live in all the places. Let's see. This is going to cooperate. I think it will. Trying to go live on Instagram. All right. Excellent. We are live. Okay, guys. So bear with me because I don't have like my usual setup because I'm traveling. But hey, it works, right? We're live. Tina, we're here together.
Hi, thanks for having me back.
Oh, I am so happy that you agreed to come back because honestly, this topic is so good. Guys, it is so good. You are in for the biggest treat. So let's go ahead. I have a little bit of an intro that I want to share before we jump in. But I do want to just say you guys are really in for a treat. This is a strategy that is completely untapped for the most part. All right. So, first of all, I want to welcome everyone back to Live with Leslie. And today, I think we are diving into one of the most important and maybe even one of the most misunderstood growth strategies for insurance based practices. And that is physician referrals. And the other thing I would add is yes, they're great for insurance based practices, but honestly, they also can work for cash based practices as well. Right? Absolutely. So I have the most perfect guest with me today. So I am so excited to welcome Tina Musselman from the Pointe. And just a little bit about Tina before we delve in. So Tina is a licensed dietitian and a licensed counselor. So she has two licenses going on here. And she's got more than 20 years of experience inside hospital systems and private practice. And she has built and directed physician-driven programs across the Chicago area and really understands how to stand out, how to build trust, and turn referrals into long-term patient relationships. So we are going to explore how to position yourself as a trusted partner for, or I should say, to physicians, how to open the door and keep those relationships strong, why understanding insurance differences like HMO versus PPO really does matter, and some simple strategies that you can use right now to increase patient flow without the burnout. So let's go ahead and jump in. Tina, tell us, first of all, welcome. Again, I'm so happy.
Back. Yeah.
So
we had a lot of fun last time.
Yes. And like I said, I'm delighted to have you here with me again. So tell us a little bit about your very unique background.
Sure. So the background I think that applies most to this is what I did within hospital systems. So I spent 18 years building weight loss surgery programs and medical weight loss programs from the ground up in outpatient hospital clinics. So when I was 26 and young, I was working at a bariatric center, but the way the bariatric center was set up, they were based out of Michigan. They had satellite sites, and they sent out this email that said, hey, we sent out all these letters that we would go into doctors' offices and bring lunch and tell them about weight loss surgery, but we don't have anyone to go do it. So they had all these doctors' offices sign up, but no one to execute or to bring material. So I was like, I'll do it. So that's how I got into learning about how you go into a physician's office or a colleague's office, connect with them, tell them what you do, learn what they do, and really build these trusted relationships. And so from that opening, I went on as like, can I be manager? My boss said, absolutely not. You can't be manager. And then 2 months later, they asked me to be manager.
I love
And then
it.
yeah, and then I learned every, role within an outpatient clinic and how to interact with hospital administration, hospital medical groups. And then from there, I got called to open up two other, practices at two other hospitals. So I've been in multiple hospital systems here in Illinois and Northern Indiana before going into private practice. So I was, sitting in the admin boards, I was in the HMO meetings, the med staff meetings, the whole 9 yards. And so I took that and just carried it over to my private practice. And here we are.
Here we are. All right. So you've got a really unique background. in terms of having the two separate areas of expertise. Can you just give everyone a quick overview on which came first and, just a little so we understand, I guess your thought process? I mean, obviously it makes a ton of sense, but just from your perspective, like what transpired that really motivated you to get that second degree?
Yeah. So my heart, my love, dietitian. Body systems, physiology. I mean, that's just my jam. I love it. I geek out on it. I love to help patients with it. But very early on in my career, I noticed that patients were coming in and unable to execute the plan. So, and I started out with a minor in psychology. I dropped that. I've always been into psychology, personal growth, self-help, anyhow. So, after being a dietitian, I would say for 5 years of working with clients, I went on to pursue the master's in counseling with a concentration in marriage and family therapy.
Okay.
So, and I knew I never wanted to be a traditional counselor. I mean, the training was amazing. It was so fantastic. It blew what I thought a counselor learned out of the water. But then I stayed in hospital administration for a long time and still working with clients. Then in 2022, when I quit my job, that's when I worked as a counselor for about 2.5 years. And honestly, there are times when, as a business professional and owning a business, you have to think, where am I going to grow? What's hindering my growth? Where can I best serve my clients? Where's my flow state where I work the best? So I decided I am not going to be a straight counselor anymore. It was great when I did it. My clients were wonderful, but there are people who are really good at that, who really love to get into some of the more intense education and the certificates and trauma training. And I decided to double down on my nutrition business. And also for counselors, we have 2 licensures. So until I get the second level of license, I can't practice on my own. So I made the decision to someone else's practice, and I had my own practice. So, so I've just been in private practice since, but dietitian's always my first hat, my first love, anatomy, physiology, biochem, the whole 9 yards.
Okay. So how do you see these overlapping now?
Oh, that's a tough question because they've been overlapping for so long. So
Uh-huh.
it changed everything. It changed everything in how I work with clients. And I'll reference back. I mean, we did a wonderful Facebook Live a month and a half ago that's on your YouTube channel where we dug into a lot of it. But really focusing on relationship building, focusing on serving the client versus serving a handout or a piece of education, or to know, sitting here today, I have so many long-term clients that we worked together for 2 years, 3 years. They're still trusting me. Like, that speaks volumes, and I love to mentor and help other professionals grow in that area too. And then it also changes how I listen. So when I worked with you, I was in Leslie's 6-figure business academy, which was a game changer. That 6 months was wonderful. And when you create your niche language, I just listen with a different ear. My ear is trained to listen differently to create that niche language. Or we're going to talk today about going into physicians' offices, how to pick up on keywords, how to use those keywords so that way you can create that bridge and create that trust with someone else. So that's really how I weave it in. And then I always weave in the mind body. I always do a really great psychosocial assessment on any of my clients, sleep, stress, concern, all of that goes into play, especially gut health and, all of that too.
I love it. Okay, so let's go ahead and dig into our topic of the day. And so tell us a little bit more. Again, guys, I'm so excited about this topic. Highly, highly recommend. Take notes because this is where it's at. Like Tina and I'll just say, before we clicked the go live button, we were chatting a little bit about how, everything nowadays is so like online driven. And I've always felt so strongly, and I have a feeling Tina concurs with this thought process, but I've always felt so strongly that it really needs to be like a dual approach, right? Yes, the online stuff can be very helpful and important. We want to have a good, a solid online footprint, so to speak. But at the same time, we don't want to forego more of the relationship building, the in-person strategies, the community-based strategies. So that's what we're going to talk about today. So Tina, can you give us a little background? What is your process for
Sure.
building and sustaining new physician engagement? So
Yeah.
excited to hear what you have to say.
Yeah. And we'll dig into it. But I just want to say, to piggyback off what you were saying, is for me as a practitioner, because technology is not my first, it's like my fifth language. So if I had to figure out how to learn Instagram, I still don't really fully understand a hashtag, or anything like that. But if I had to wait to feel like I couldn't get movement in my business till I learned all that, I probably still wouldn't be open. So that's kind of my kryptonite. So I worked with what I had and it worked. And the nice thing about this is it's low cost, like very low cost to free. It's your time and you can get going with less than $500 and really get your whole business up and running with this type of networking. And it is old school, business to business. Let me meet you. Let's build a relationship. I mean, it's a little slower, but once you get it going, it's a hockey shape. It's that hockey stick growth that you can see exponential growth over time once you take the time initially to begin with. So for those people who think it's expensive or hard, or it's not, it's very cost effective. For me, it's cheaper than running a Facebook ad. So, and which I don't even know how to run. I have to pay someone a lot of money right now to run a Facebook ad for me because I've tried running them. And, I spent $100 or $200 a month and didn't really get the return.
Okay.
So for some people that works really well, but for me personally, it's harder. So I prefer this type of networking, especially with licensure. And if you're local and you're in your community and you can work within your state, you can do this. And that's what I want everyone to walk away with. And this is a great time because I don't know about you guys. I mean, I'm still pretty busy. It's probably the busiest December I've had, but it's still cancellation season. People kind of run, unless you're a therapist and everyone's going through family dynamics of holiday parties. A lot of us, we have a lot of free time this season. So this is a great time to block 2, 3, 4 hours and get some traction on what we're going to go over. It'll pay off. So step 1, the first thing you want to do is you want to have just a couple handy pieces of marketing material available. So you don't need a huge plethora. You don't need anything fancy. I'll show you mine, but I have 3 kind of main sheets. I keep these ready to go anytime. So, and I'll go over what's in here, but I have like a little flyer on, how we support your patients in between office visits. And this is all on Canva. You can even tell ChatGPT to go read your website and help you put these together. You could do that really easily. I have a patient testimonial sheet. I have a little trifold brochure, which I would say is completely optional. And then a card on how to refer. And we'll actually talk about this because this is probably the most important card. And then some business cards. So this could be done in a day. It can be done in a day. It's very easy to do. You could do it on Canva. I do kind of outsource a little bit. I do have someone help me with PDFs, but I did it in the beginning. So once you have a couple materials, then we can dig it. So how do we get started? And it's time and it's playing around the internet, digging through Google. So I always try to block my work. So that 1 helps my focus, and 2, it helps me maximize my time and effort. So I will take, I don't know, Friday night or Saturday night and okay, let's pull up another 25 contacts in the community. And that's where I start. So it could be more than just doctors. It could be counselors' offices. It could be maybe chiropractors that do nutrition. And I'll go over how I find them. But I just start digging through hospital websites. I'll go on a hospital website, search primary cares, and just pull up unless you're in a major medical institution, which you're going to really be taking time to filter through that. I'll just start pulling up primary cares and getting a list together of who I want to contact, who I want to market to, who I want to drop a packet in the mail to. And we'll go over all those steps because there's you kind of want to blitz them to begin with. That's a good way to think about it. I'll fill out a contact us form. I'll throw something in the mail. I'll send a fax and a phone call to start. So, because the whole goal of what we're trying to do is to get in the door with a face-to-face meeting. So you're going to think of yourself like a pharmaceutical rep.
Okay.
So if you've ever interacted with someone who maybe sells, if you were in pediatrics where they come in with GI formulas or a 2-feed formula, or if you were in, diabetes education and you see those reps come in, that's what you're going to do as a private practice owner.
Okay. I know that world very well. That's the world I came from for 13 years, sales and marketing in pharma and diagnostics. So
And
yeah.
so, Leslie, if you went to a doctor's office once and didn't go back.
Oh no, you find a reason to go back.
Yes.
That's the key, at least from my perspective, back in those days. Like you're always like, okay, I'm going to swing by Dr. So-and-so, even though I haven't been able to see him or her yet. I'm going to drop something off. I'm going to drop off a new study or, just something that would be of interest to that person. So you're
Correct.
just always looking to support them.
100%. I mean, I will tell you, I got 2 big contracts this year. That was a relationship, and I'm not going to say it's going to take this long, but it was a relationship that I nurtured for a long time. Probably since I've been in business. And every time I saw her, she was like, "Hey, let me tell you, I can help you." And they were like, "Hey, help me." And then I got the call.
Wow.
And then you get the call. So, but that's how you want to think of yourself. If you've ever interacted with a pharmaceutical rep, and I've worked for drug device companies before, helping them market their product, go into doctors' offices on their behalf. So that's the kind of mindset we're going to take. So I sit down with Google. I will pile through hospital websites. I will do a zip code search, primary cares within a town. And then the key is if you're an independent business owner, look for other small independent businesses. So I'm not sure where it's at for all of your listeners and all of your viewers, but I'm in the outskirts of Chicago in the suburbs. We have huge major medical conglomerates here. And when I used to work in the hospitals, I know they tell those providers you refer in network, and they watch where every referral goes.
Yep.
They watch where every single and if Dr. So-and-so continues to refer out of network, they might have a conversation with Dr. So-and-so, which may be to a disservice of a patient, but that's neither here nor there, right? But that's
the way it is, right?
really what we're working with.
Yeah. Those big medical systems, they just really can't refer out. Would you agree?
Right.
Is that pretty much what you're saying? Okay.
They can. I mean, I get them from major medical systems, but it's usually because a client went back and talked about what a great care they received. Or, I'll get a provider that gets on board. It's just a little more difficult. It's more difficult to get in the door. They're more protected. Whereas other small businesses, like I prefer to give my healthcare to small businesses. I look for independent doctors so I can support those doctors with my kids' care, my husband's care, my dental care, so they're more likely to also support more small businesses.
Okay. So are you saying, for the most part, we're looking at like private practice?
If you can. So how is when you're on a hospital's website, it'll tell you if it's a part of their medical group or employed, or it'll, their practice will say like medical group of such and such hospital. So there's ways to tell, or you can go to their website and you can find out if they're an independent provider. So it takes time. But once, and that's why I like to block schedule, because once you get in the cadence and in a group, it's easy, just like click, 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 and you know exactly then what you're looking for. Your eyes know right where to go. And it's very easy to develop your list.
Okay.
So, and then the other places to go is if you have a niche, right? Search gastroenterologist. If you do fertility and women's health, you need to go to the fertility clinics. You need to go to OBGYNs. If you do menopause, go to the Menopause Society. If you do Institute for Functional Medicine, go to their website, Google, search these major medical organizations that also have your niche, and then find who's in your state or your zip code or whatever area you want to service. And I've gotten great relationships from that too. So I have some great referrals just digging around on independent professional websites. No matter how small they are, they tend to be very open, especially if you use their language when you're reaching out to them to meeting with you.
Okay. So I don't know if you want to answer this now or later, but the question is always like, how do I reach out? Do I go there? Do I email? What if I don't see an email address? Do I talk to, maybe someone else in the office? Like
all of the above. And that's exactly where I was going. So so what I will do, I grab my stack. I keep a stack of these ready to go. So these are my physician packets. I keep a stack. I'll always restack a stack of 30. So, and they're usually an envelope. I took them out so you can see them. So what I do is as I'm going through, I will prepare a packet, get it ready to go in the mail.
Okay.
And I used to run to the post office, but I found that was a barrier because I hated going to the post office. So I dilly-dallied a lot. But so now I just got this great label printer. It's like $65. So I can print postage right now. So, and I'll talk about how I use that to maintain relationships follow up because I drag getting to the post office. So, so we're gonna do all the above. So get a packet ready to go. I like to handwrite notes. So remember, our goal is to try and meet a provider face to face. So I will add a handwritten note saying, sometimes I'll address it to the office manager if you can find an office manager on a website because they're the gatekeeper. So office manager, referral coordinators, you want to know all those people's in the office because they're the gatekeeper, whether or not you're going to get to that provider. Their job is to keep that provider's time. And I know it because I kept the time of surgeons for a long time and protected them from whoever happened to stop by the front desk, So the goal is if you can get a face-to-face meeting. So I will write a handwritten letter saying, hello, Dr. So-and-so, I was looking to connect with local providers. I saw that your mission statement is aligned with my mission statement. I would love the opportunity to come in, learn about your practice because we want to be interested in them too. This is not just about us. And then I would also love to tell you about how we can help support your patients. If I can bring a coffee, a breakfast, or schedule a few minutes to stop by, I would really appreciate that opportunity. And I'll put that handwritten letter in my packet. And you'd be surprised how many people call. I mean, I've even had doctors just call and set up a Zoom. Like, I have 5 minutes, I can set up a Zoom and I'll get on a Zoom, So sometimes you get surprised.
That's great.
It is great. And then what I'll do is
part of it, it's the taking the time to handwrite something is what I'm hearing, right? Because that's kind of unusual nowadays. It catches your eye.
And I use that for so much of my practice. I'll talk a little more about it, but I use it for my patients because I'm virtual. So I'll drop letters in the mail to my patients. I write handwritten thank yous.
Okay. So to be clear, and for everyone listening, send your questions in just so you have some clear action steps on what's next for you in your own business. Okay, guys? So really, we welcome your questions or comments. And plus, I'd love to hear maybe a little bit about what you're currently doing in terms of garnering physician referrals in your practice. But okay, so Tina, what I'm hearing in summary so far, I know you got a lot more to share, but you have these packets pre-created, pre-printed, ready to go. Took a little time initially, but now, obviously we just print them and assemble them. And then you do some research online, right? In terms of figuring out who to send them to.
Correct.
And you're writing a handwritten note, putting it in the packet. And I believe you said you're sending those in the mail.
Correct. And then, I'll send them, or sometimes too, I will hand deliver. If they're close, I will hand deliver.
Okay, got it. So it sort of depends on the.
We can talk about what to do when you show up in the office because that's important. So, so I'll drop it in the mail. Then I will take my 3 pages. I have a fax. I will fax it right away too, with a cover letter that says almost the same thing as my handwritten letter. So I'll send a fax. You can find a fax number. And then some of the smaller providers, like versus those big medical groups, they will have a contact us form on their website. I'll fill that out. So that's 3 touch points within 5 minutes.
Okay. So mail or in person for the packet, a fax, and the contact form.
Yeah, contact forms are great.
That is so brilliant.
Yes.
Okay. I love it. Okay. So it's 3 hits. 3
hits to start. And I will tell you, just be prepared for rejection. I forgot to give that preface when you said how you get prepared to start. Like this is, I can't remember who, I think it's Daniel Priestley who says entrepreneurship is the life of 1,000 pitches. So if I do this for 25 or 30 practices, maybe I'll get 1 respond. So I can't give this discussion without that disclaimer because it's so important not to get your head out of the game. Like you're going to be in it to win it. Just be prepared to fail. Be prepared for no's. If you get a yes, it's a bonus. But we just keep going with it because you need 1 good refer to get the ball rolling.
And we do have a question that came in on Instagram from Katie. She asked, do you put QR codes on the packet? What do you look to?
Super great question. And that's why I also brought it as an example. So I do use QR codes. I could probably update these a little bit, but the biggest and best QR code I use is I have one, this one here links to my website. So they can just scan it to my website. Although I'm probably going to, after taking your course, Leslie, I know I need to do more video. So I'm going to update it to a video welcoming them to introducing my practice. But two, I went into one of my highest providers' office, one of my highest refers. And this was so great because this was her idea to some extent, not mine. She brought out this, I'll just use this ratty, like, oh, this one happens to be yours, Leslie, piece of paper. And she goes, Tina, I am so tired of taking out this piece of paper and telling my clients to take a picture and hope they call you. And so she had it in every exam room with my business card blown up.
Amazing.
So I said to her, I'm like, I got something for you. So I then my like third or fourth round of business cards, because you don't have to get it perfect to get it out. Just get something out. I now have a QR code that goes right to my EMR for people to schedule. And they have to do a $5 deposit. So I get a credit card online to hold the appointment, but this is all automated then. So now I bring stacks of 500 cards in these where patients are now self-scheduling, which is great.
Oh, so interesting. Okay. So a $5 deposit to hold a spot for a conversation with you.
Right. Because I don't do discovery calls.
Got it. Yeah. Because you're in the insurance model.
Correct. Okay. But I was like, okay, if everyone starts scheduling, there's a risk of me getting a bunch of no-shows. So I really had to think that through.
Oh,
so and I wanted to make sure I had a forced credit card on file. So, so yeah, so far it seems to be working really well. I have 3 providers actively using the cards and it's worked out very nicely. Okay. And even today, my receptionist said, Tina, Dr. So-and-so is sending a lot of patients. And I said, she goes, but the faxes are blurry. Or she's sending them to my contact us form on my website. She says, everyone who's filling out the form on your website is coming from Dr. So-and-so. And I'm like, great, I'm going to go out there. I'm going to bring a stack of these and get them scheduling instead of going to my contact us form.
Got it. So we have a question. Hey, Katie, great to have you with us today. So Katie asks, are you using a spreadsheet to keep track of who all you're sending these packets to? And also as a mechanism to track the conversations?
Correct. I do. Yeah, I do. I know there are, like, I use a company who, like, for all my email marketing, there's a way to track people in there. I just haven't learned it yet because they have a very nice follow-up system. But yes, I do use a spreadsheet to track everything. And anytime we get an inquiry from any patient, and I'll talk about how to have them refer to you. Anytime I get an inquiry, we always note who the doctor is. So I know who's referring, who's not referring, who I'm going to spend more time with, who I'm not going to go back to their office to. So we keep track of all that.
Perfect.
So that's how I use QR codes, to be honest.
Okay.
So, and it seems to be working pretty well. But great question, Katie. I track all of it. Because you want to, as a provider, you want to know where you want to spend your time. What's worth it, what's not worth it, what's working, what's not working, who's receptive, who's not receptive. So, and at some point you're going to cut people loose and be like, I'm just not going to spend my time there anymore. So it's really important we know those things.
Okay. So are there any other steps in your process? Again, for anyone that's just joined. So Tina's giving us an overview of her process for building and sustaining new physician engagement.
So there's the blitz, kind of what we talked about. And then if possible, I try and schedule once a quarter. When I first started out, it was once or twice a month. I go door to door. And so, because I always go to the front desk and that's the gatekeepers for lunches, breakfast. I usually have this old kind of ratty, like scheduling planner they'll pull out still. And they write in there with a pencil and they erase people and they keep people's business cards in there. So when I go door to door, I briefly introduce myself. And then I say, is there an opportunity that I could possibly come back with lunch or breakfast? Does your office do this? Can I schedule something? And a lot of offices still can schedule for me to come back. Some offices now, they have policies and procedures that they won't let outside, reps. You are a rep, right? Outside businesses reps schedule with the office. So it's kind of hit or miss. But if you the golden ticket is you getting face-to-face with that provider in any way, shape, form possible. So they can put a face with your name so you can learn about their business, so you can tell them about your business. And that's how we start building that relationship.
Okay. So you actually go to the front desk All right. So this is a question I get a lot.
Mhm.
What do I say? Leslie, what do I say? I'm walking in the office. I don't know what to say to the lady at the front desk or, the man at the front, whoever's there.
Yeah, so practice this at home in your mirror before you head out. Practice it in your car. Like, find your words before you go make these visits. But remember, one, you're a healthcare professional too. And I think we forget that when we're talking
Yeah.
to doctors. You're an expert, you're a healthcare professional, you have a lot to contribute, you have a lot to say, and you're smart. So I'll just go in and I'll say, hi, I'm Tina Musselman. I own the Pointe, and we're a team of dietitians who can help support Dr. So-and-so's patients in between their office visits. I brought some materials with me, but I would really love an opportunity to possibly meet with the provider. You can use the provider's name, and you ask, you always do that. This is no different than ending a discovery call without the ask, right? So I will say, is there any opportunity where I can come back, where I can schedule something? Does your provider have 5 minutes today to meet with me? Can I bring lunch? And sometimes they may schedule a lunch 3 months out, but you still got it. And
Okay.
so when you're doing this, bring a book. You may be sitting in a lot of I've spent hours sitting in waiting rooms, but it will pay off.
Okay. So you're actually bringing the entire office lunch.
Yeah.
Okay.
I mean, granted, they don't have 30 people. Yeah. Like most places, it's 6, 7 people, maybe 8 people.
Okay.
I'm not catering lunch for 30.
Gotcha.
So, and keep in mind, we're in healthcare, so I don't bring big, elaborate junk food. Like, it would be an oxymoron for me to show up with a buffet of, burritos. I mean, I have my trusted, lower cost businesses that I go to for lunch, but picking up fruit bowls, picking up, I bring a lot of times. I just went to a huge counseling agency. They didn't want lunch or coffee. I brought a basket of healthy snacks, like new snacks they could try, and they were so happy with the snacks. So, yes, I do. I bring lunch.
Okay. I love it.
Yeah.
So, I mean, food does get you places. Let's just be honest, right?
It does. I mean, it was wild. I had an office. We were next to the diet because no one came to bariatric surgery with lunches because we got people off meds. So I had 2 device companies that drop by once a year, but we were next to diabetes once. It was shocking what was brought into those diabetes offices every day for lunch. It was wild, but yeah, people like food, and doctors still do schedule lunches. It's a little harder with those major medical groups because they do have policies in place, but some of the smaller providers, their staff is so nice and grateful, and they will sit down and take the time to talk with you.
Okay.
They want their patients to get well. That's why they're a doctor.
Yes, they really, really do. And yeah, I think that's such an important point. They want a trusted referral partner.
Right. And especially because so many of their visits, they're 8 minutes, they're 15 minutes. I have one provider, she'll take an hour with new patients. But if you go in there and you're like, I'm here to enhance, I'm here to help the patient execute their plan. Because believe me, patients are coming in and telling doctors what they see on TikTok. They're telling doctors, what they saw in the latest book or podcast. The doctors have no idea. They're not on TikTok looking at all this garbage that our patients see. But we have the time to navigate, and if we sit with patients. I just had a patient this week. She's one of my first and highest referring physicians. The patient was really struggling with her weight, but she was going down this path of depression. So when I sent my note back to the doctor, which we'll also talk about, I put it here. I'm very concerned about her mental health. We almost need to take a break. She's isolating. She's a very social person. She's very depressed. I am concerned that this long-term super caloric restriction is really negatively impacting her. So I guess she went to her doctor and said, I told doctor that you didn't want to see me anymore. And her doctor pulled out my note and said, no, you got to read what she wrote. And she read her my note and my concern. And the patient was just crying, I had no idea you cared so much.
My goodness.
And so yeah, I know I got goosebumps. I'm I was very concerned because you should be social. You should be doing stuff with your mom. We shouldn't be so worried about food that our world is getting smaller and smaller, because she was so afraid to eat anywhere. So, but doctors do appreciate that. They really
do. So we have a couple questions that came in. So you can see the first one here, asking to show those handouts. And Yeah, so I'll let you handle that one. And then we have another question on Instagram about your follow-up process.
Mhm.
And this is from a different Katie, who is, she just mentions that she really struggles with, the follow-up.
Yeah, so
So
we'll
I'll let
talk
you
about
do
that.
that in any
So I'll
order
start
you.
with the handouts. I hope you don't
Okay.
mind. I am going to give a little plug. So it's delayed, but I have 3. I'll go through them, and then I'm working that you could buy them. You could buy all the templates, and I actually have. I
Mm,
wrote out a 40-page manual. I'm just waiting for my teamwork, my coworker to make it pretty.
okay.
But I'm going to put it on well-resourced RD, and you could buy it all. But and same thing, step by step, deep dive into all of this. So what I have is this one pager. These were the ones I started off with, and I created these myself. But this is a one pager just about, I was very clear, like, these are the disease states we serve, we take insurance, and here's how we support your practice. Because I think when you get into business to business marketing, your patients are not your only clients. These doctors are your clients too. So you're not only serving your patients, you're serving these doctors, and you have to treat them like a customer. So we're not talking about how we're serving ourselves or how we're serving patients. How do we help the doctor deliver better care and have their patients get better outcomes? Just as we would talk to a discovery call, right? So that's what that sheet's focused on. I have a testimonial sheet. These are testimonials from my clients. In my EMR, I have a testimonial release that if someone's having a really great experience with us, I will say, can I send you something so you can move and inspire other people to work with us? And then I shoot them off a testimonial sheet. And all my providers are trained to do that too. So then a referral card. This one I'll go over because this might be the most important one, how we ask for a referral. And then a brochure. I would say this is optional. And then a little stack of my business cards. That's what's in here. So nothing crazy. Where I'm not putting journal articles in. I'm not putting anything, super crazy in there. Just straight, short, sweet, to the point. They don't have time to read, lengthy things. So, and then the second question, what was that again, Leslie? The one from Instagram?
Yeah, the second question was, I'll read it. Can you chat more about the follow-up after a drop-off? This is what I struggle with.
Yeah, so the follow-up is really important. So remember, all you need is 1 or 2 physicians to get the ball rolling, and then it's going to build your confidence and it's going to build your practice. So 1, be ready to fail. Don't take any rejection, any non-response, any non-follow-up as anything personal. Just like we're busy doing EMRs and checklists and insurance checks, the doctors have it 10 times as hard. And I know that because I ran it, for a long time. I ran insurance denials. I did, all that stuff. So don't take it personal because everyone is overflooded, overworked, overburdened. Physician burnout is very high right now. So don't take it personal. So for follow-up is if I ever meet a provider face-to-face, I write a thank you card. Thank you so much, Dr. So-and-so, for taking the time to meet with me. It was lovely to learn how much you care for your patients. I really look forward to supporting them in the future. So you're going to thank them for their time. You're going to do everything you can to stay top of mind. So, or if you send out packets and you don't hear anything, you can always call and ask to speak with an office manager because that's the gatekeeper. Maybe the office manager can help you get a visit or learn a little bit about your practice or take your information and give it to the medical, or the referral coordinator. So there are different ways to get in. Let's say you get that referral. What's next? This is really, really, really important. Every single visit note goes back to that provider. I don't care if I've been working with someone 3 years or if it's someone's first visit. Every single note goes back to that provider. And I'm going to tell you, they don't read it. They don't read it, but it's there. They know they're seeing you. It could be referenced in an office visit. They're going to see, oh, I referred a patient to Tina. They didn't go. I'm going to talk to this patient next time they're in the office. They see that stuff. So then every single office visit gets a letter sent back.
Okay. So is this sent via fax?
Yeah, I fax it back immediately. As soon as we sign off, the patient part goes to the patient and then goes right back to the doctor.
And Tina, is it fair to assume that if I'm running a cash-based private practice, I would follow the same protocol?
100%.
Okay, that's what I thought.
And under no circumstances would I never send, unless I don't have a medical release on file, right? But under no circumstances would I never send a note back.
Okay. All right.
And if you
Every
have,
single visit, you send a follow-up to that provider.
yes, and if you
And
have
this
a
is
patient with an
for
urgent
referrals.
issue,
Okay.
pick up the phone.
So what if you didn't get a referral, but you know the provider? What would you do there? And you have permission to communicate with the provider. Would you send them anything to try
Wait,
to
let me rephrase that. So
generate?
you said, what if I didn't get a referral, but I know the provider?
Yeah. So the patient or the client just came to you,
Got it.
and they indicate, okay, I see, Dr. So and so,
Mhm.
and they give you permission to communicate with the healthcare team. Would you,
Oh, yeah,
send follow-ups in
every
that
note
case?
goes out. As long as a medical release is standard on
Okay.
all of my patient intake forms.
Okay.
As long as I have a medical release on file and we follow HIPAA, every note goes out. Now,
Gotcha.
if I have a patient who found me through Blue Cross Blue Shield, and it's a doctor that I've never gotten a referral from, guess what's sitting right next to me, Leslie? This is going right in the mail with their note. So
Oh,
then
I
I will
love it.
print that note and
Okay.
hand right to the doctor. Thank you so much. This is what we do. We're so happy to work with your patient. I'd love to come and tell you about our practice. And this goes out. Or
Okay.
if the doctor's local and I haven't met that doctor before, I will walk my note over to the doctor's office and drop it off at the front desk.
Amazing.
It takes time, but it's worth it.
Yeah,
It's
but
worth
it's
it.
worth it.
And
So I
then,
don't want to forget. So can we earmark this? I don't lose your train of thought, but I want to make sure we talk about that thing that you said is most important.
yes, we will
So,
do that.
all right.
But yes,
You don't have to
every
do it now.
single note goes out.
Okay.
Okay. So, and if a patient tells me, oh my gosh, I have this amazing OBGYN, I just love working with him or her, I will ask, who's that OBGYN? And I have a little pad of paper and then I send them my marketing materials. Like, I have a patient who just says your office is amazing. I would love to work with more of your patients. So you're just constantly asking. It's 1,000 pages.
I
It's a
love
thousand,
it.
but you got to have the ear to listen. So pull from your patients. Yes. And so every note goes out. And then
Sorry. There's a little overlap.
okay.
Or delay. What I was going to say is one of my takeaways is on your intake form. Obviously, you want to gather the names of their medical providers,
Mhm.
right? So if you're not asking that question, might be a good one to add. Okay.
Right. And it's nice too, if you don't have providers to refer back, like I have more and more people who need psych testing or their kids need psych testing. And they're like, I don't know, the place they told me to go is, 6-month wait. I have relationships with psychologists. I have relationships with psychiatrists. Oh yeah, I will be so happy. I love referring back to my referring providers.
Okay.
And I would say too, the best thing you can get is a patient that goes back to their doctor to tell them how awesome you are. So you're going to have to provide excellent care. I mean, I've had doctors pick up the phone and call me and be like, Tina, so-and-so says they're not getting a call from you, and you have to provide excellent customer care if you're doing this. Because all it takes is one bad review. I mean, it's more kryptonite than a Yelp review. If you get 2 people that go back to their doctor and tell you working with you is awful, expect those referrals to stop.
Oh, yeah.
So you got to provide excellent patient care. I'm going to finish the follow-up just so we can stay on that. And then we'll go into the most important thing.
Okay, good. Perfect.
So all notes go back out. Then I will give little reminders and nudges. So in a perfect world, I would go out quarterly to my doctor's offices. Right now, I'm not going out quarterly because we're so busy. But I also I'm bringing a new dietitian on so I can go back out again. So, because it's like shooting myself in the foot, right? Like the less I market, the less we grow, the more we grow, the less I can go out to market. So I'll be going out again, but I try and get out quarterly or at least half annually. Same thing. Hey, I want to touch base. I want to see, are we providing the care you want? What type of fee? Can I book a lunch? And usually once you get in there once, they'll have you back again. And then I will, like the 2 contracts that I got in Indiana, I sent thank you charcuterie boards. Thank you so much. We are so grateful. You trust us. We are honored. Here's a charcuterie board. I've sent edible arrangements. I will send at Christmas time a subscription to Nutrition Action to show up at their waiting room every month. And every time that magazine shows up, they're going to think of me and my business. So you can get creative. We have a local place here. She's a non-profit. She paints these pots and then she goes into school to talk about suicide prevention to kids, I will go there and get a custom made pot from her with a plant and put my card in there and bring it in the office so it sits in the office all year round. You just want to keep staying top of mind.
Mm-hmm.
This year I'm sending out my family Christmas cards. I used to love to get family Christmas cards from our reps. But I'm also going to add a newsletter of like what's coming in 2026. So you want to make the rotation with your highest referring providers at least once or twice a year.
Okay.
So, and it could be, like you said, an article, it could be a newsletter, it could be dropping off a plant, it could be bringing a snack. Hey, here's some new snacks that came out in 2025. They're for your staff, but you do want to keep that relationship building going. If you don't put energy into it, like anything else, it'll die. And I'm sure you can attest to that from working in the industries you worked in before going out.
Absolutely.
Because there's going to be someone else that comes in.
Yep. You got to stay top of mind.
You got to stay top of mind. So yes, I have and that's where that tracking spreadsheet comes in handy, because now you know who you saw, who referred, and so on and so forth. So, but this is an ongoing, it's not a one and done. It's not a one and done. So do you want me to get into the most important thing?
Yeah, I do. Yeah. Why don't we talk about that and then see where we're at?
Sure. So the biggest mistake I see, because I'm in a couple of Facebook groups, I'm sure as everybody else is people go, oh, what do you put on your physician referral tear pad? Do not make a physician referral tear pad. It's going to go in the garbage.
Okay.
Why is that? Everybody's on EMR. Everybody's on fax. So if you're creating a physician referral tear pad, that means that someone in the office has to fill out that sheet of paper and find a fax and give it to you.
Okay.
So you're putting up a barrier to care, to an already burdened office. So do not create physician tear pads. Okay. That was probably 2002.
Okay.
So what do we want to do instead? And that's where this comes in. So on here, it's my NPI, my tax ID, my email, my phone, my fax, the CPT codes we use, and maybe the top 3 diagnosis codes we see. So for dietitians, like nutrition counseling and surveillance, here's your obesity code, here's PCOS code, or we see a lot of metabolic fatty liver. So that's what's on here. And number 1, I'll go from least effective to most effective. So you can ask for referral that 1, here's my card, have them call, they can scan on the back. Ball is in the patient's court though. You have no control. You don't know who got that referral. You can't follow up with that referral, but the ball is in the patient's court. And we know people are busy and cards get lost. Number 2, ask them to be put in their EMR. Don't be shy about it. Can you build me into your medical record? And I have many where they just print their after visit summary. My business name is on there. Referral to dietitian, Tina the Pointe, our phone number. Ball is still in the patient's court. But at least there's nothing more powerful than a physician saying, here, this is who I trust. This is who you're going to go see. And there's a cardiologist name. There's your name. Okay. So after visit summaries are great. Please build me in my EMR, in your EMR if you can, which big medical groups have a hard time doing, but not independent practices. They can put whatever they want in there.
And this is in the patient note, right? Like the follow-up note.
Yeah. Like if you go to the doctor, like, oh, here's your after visit summary. Let's book your next appointment. It's on there.
Gotcha. Okay.
So, and then number 3, the best way you can get a referral, and this is the ask, it is my most successful way of seeing patients, although these little cards are coming in pretty good. Have them fax over a demographic sheet or a progress note.
Okay.
So patient leaves the office, we get a fax. And then the ball's in my court.
Okay. Okay.
Now I have a hot lead.
Is this a referral form? What is it exactly that they're sending you?
Some doctors, they'll send like a demographic sheet saying this patient's been referred to you.
Okay.
Sometimes they'll like have the patient. I don't know if the patients are signing a medical release. I'm assuming they are, but it's no different than if they tell you to go see a cardiologist and they notify that cardiologist, they want you to see you.
Okay.
Right. So then going back to spreadsheets, we track every referral. We have a process, a very standardized process. Every inquiry, every fax gets 2 reach outs.
Okay.
So Dr. So-and-so sends us a fax. We give 1 phone call. Hi, this is Tina with the Pointe. Your primary care referred you to see a dietitian. happy to answer questions you have or get you going with scheduling.
Okay.
And then we'll do that twice before we leave the ball in the patient's court.
Okay. Is there anything we can do to help facilitate them sending you this, this information via fax?
You got to ask. Ask or ask the referral coordinator, hey, what's your typical referral process?
Okay.
Like I said, most people want to help people, right? You got to ask. So if a referral coordinator comes to a lunch or you meet a referral, how do you typically, what do you need from me? How can I help you refer easier? How can I make it easier? So ask them, what's the process in your office?
Okay.
So yeah, just ask.
Just ask.
We're just so afraid to ask. We're so afraid to pitch. We're so afraid to brag about ourselves. We're so afraid of rejection. But ask.
Yep.
And a lot of times if you have a good physician visit, they'll ask you, how do we send patients to you?
Yes.
Let me tell you, if you fax it over, I have an awesome receptionist. We're going to reach out to that patient twice. And they usually, I've had doctors call me like, we've sent something. This patient said you didn't call them. And I can go right to my spreadsheet. I'm like, no, we called them on 12/1. We called them on 12/5. We just haven't heard back. We'll call again. No problem, Dr. So-and-so. We will get a hold of that patient. We will get them in as soon as possible.
Okay. I love it.
And that is excellent customer service.
Okay.
So you have to be, I don't want to say it to be intimidating, but just provide excellent care. Think about the care you'd want to receive. That's what you're going to provide, for these patients and these doctors. So that's what's on this card is it just says here, I'll read it directly to you. There's my MPI, my tax ID, phone number, fax number. Here's who we're in network with. Provide the patient with the Pointe's contact information. If a demographic sheet and progress note, fax it to this fax number. We will initiate contact with the patient.
Perfect.
And then if it's an HMO, we need a referral. And then here's my top 2 CPT codes. That's it. It's very clean. It's very straightforward.
Okay. I love that. It allows you to follow up directly with the patient versus, like you said before, just completely leaving it in the patient's court.
Anything you can do to get that lead and control the lead.
Right. Yes. Because cards get lost. I think patients mean well, but things get busy and things can fall in the cracks. So if you have that, whatever it is the physician is referring to you, the referral form, whatever it is, it's really going to help facilitate and lock things down.
Right. It's no different than if you're in a major medical system and a doctor says, well, you're going to go to cardiology. Cardiology might get a notification that patient's being sent to you or you're in their bucket, right? Yeah. So you got to think like a business. That's the biggest thing. You have to think like a business.
So can I ask you, so one question that I often get, Tina, is, okay, what do I say to the physician when I get in front of the physician, right? So do you have any tips there?
I do.
And how do we close in your process? I have thoughts about how I would do it, but I'm really curious to hear, because I'll give you a little, background. So what I hear is, we get in front of the physician and we say, well, think of me, think of me, or, something really kind of, vague. And then it takes forever. Nothing happens, right? So how do we tighten this up?
So maybe you'll get 5 minutes, maybe you'll get 45. You don't know. So you're right. You have to be prepared and have it tight. Yeah. So practice. Okay. And each time you go in, just think of it like practice.
Okay.
Every time you go out, this is practice. You're going to get better with everyone. So this is no different than a discovery call. If you want to get that person talking more than you're talking. Tell me a little bit where are you seeing your patients struggle? So if you can almost turn the tables and get them talking, I'm sure a lot of your patients want to say they want to go home and work out, but then you see them next visit, they're not working out. What are they telling you is the problem? Oh, they have kids, right? Let me tell you, we work with a lot of people with a lot of kids. We're used to navigating that. So you really want to get them talking versus you just pitching. Be genuinely curious and interested about their practice, their philosophy of care, their patient barriers. And a lot of times I don't do the majority of the talking, but I will Leslie, you know this, I never thought I could have niche language until I'm going to keep saying, like, Six-Figure Business Academy is amazing, but I never thought I could have niche language because we're like the primary cares of nutrition. We work with a lot of people. But through your course, I was able to say, okay, we help adults bridge the gap between knowing and doing in order to transform their health. That's what we're really good at. And so you just have to kind of find your language. You're going to flounder. You might think you sound stupid, but just keep going and get them. Sometimes I'll ask the doctor straight up, what type of patient do you think could use our services? What type of patient could you see referring to us? And they'll be like, oh, Mrs. So-and-so, I just saw her today. She'd be great to work with you. She'd be great to work with you. And then they'll call that patient and give them my number. You know, so ask them, what kind of patient could you see working with us? So you can get an idea of what they're thinking, you know, and sometimes I'll share case studies. You know, sometimes I'll tell doctors, send me your hardest person. I promise you we'll get results. Like, and sometimes they're a doozy. I do get some hard ones, you know, but like, just send me the patient that doesn't have any hope anymore. Just start with that one patient, right? But you have to get comfortable asking. And then I just always close with thanking them for their time and just remind them, like, yeah, all you have to do is just send a fax. You know, we'll take the ball from there. We're so happy to work with you. Here's my cards. You know, if you need anything, let me know. So
I love it. Oh my gosh. Okay. Guys, I hope you heard that loud and clear. What Tina said is so true. We want that person, that provider, to be doing most of the talking, first of all. And the other really important thing here is you're asking questions. You're trying to identify where their struggles and challenges are in their practice with their patients so that you can swoop in and essentially save the day and serve and fill in that gap. And in order to identify where that gap is, we have to ask questions versus just kind of going in assuming we know, right? I love it so much. And then what I really loved about what you said is, I think you said something like, you know, who can you visualize referring to me?
Yeah. And it's shocking. They'll sit there and come up with names. Oh, so-and-so and so-and-so. Oh my gosh, I just saw and it was such a long appointment. I wish I would have known you yesterday.
Yes.
You know, so they'll come up with names and like clients will stand out in their heads that they wanted resources for that they didn't have.
So in the process that I teach, I literally say, like, the closing question could be, so Dr. So-and-so, you know, looking at your schedule this week, can you think of maybe, you know, two patients that maybe would be a good starting point for us? So the whole idea is that they're starting to think of names. Once you hear the names, and they will share name, or I mean, they might, you know, not like,
they'll have some patient image in their mind of who would be a good fit for you.
And then what you have to in air quotes, right, is you want to find out how you can help facilitate the process, right? And so at that point, you might chat with the referral coordinator, or, you know, you just want to make it so easy for them to send their patients to you. So I love it. So good.
Can I add one more tip? This just happened to me. I had 2 practices reach out to me recently. Like, I reached out to other practices and my mind was blown away. One happened to be a medical weight loss menopause practice. And it was a new nurse practitioner getting up and running, wants to build her caseload. She found me somehow online. We went and had coffee. I replied back to her, like, oh my gosh, I can't believe you found me. I would love to come have coffee. So we met and had coffee. And I told her, I'm like, look, going into the new year, if you want to do, and this is one of your tips, and I remembered from your work, Leslie, let's do a free online class for the new year. Where one of their providers is going to come on with me, and she's like, I talked to my providers. They're so on board with this. We're going to do, you know, a live session in January. I told him, like, I'll throw in some Facebook dollars. You could throw some Facebook dollars. Let's do an online collab, you know? And so I have that going, but I had to remember to ask.
Okay. Yeah. It's all in the ask, right, guys?
Cross promotion too for small businesses. They can do stuff with you if you can cross promote. I mean, I have an email list. My email list is probably almost 2,000 people. That's valuable. You know, that's valuable.
Sure. Okay.
I know this takes time. It takes effort. It could be frustrating, which is why it's so important we talk about mindset. And I go through the whole mindset in that packet that's going to be up on Well Resource, hopefully next week. But one, don't give up. And I will tell you is hope for anybody out there. I'm coming up on 4 years in February. I
Okay.
didn't start with a patient. At year 3.25, I hit over 1,000 patients. So, and that's without social media, without ads, without TikTok dances, without anything.
No,
So
no TikTok dancing.
it's my kryptonite. It's my kryptonite.
We're not.
But I'm not pointing to the things. I'm always authentic in what I do. What I do is always aligned with me. So I just give it as a comment of hope. It's totally, totally possible.
Yeah.
And now I'm up to like 1,500 patients since the summer through this type of marketing. So it's absolutely 100% possible.
Okay. And this costs you, I mean, other than, getting some of the content
I would
printed.
say, yeah, less than $500 to start. An average lunch is $125, and the rest is my time.
Yep. So you're not running ads. You're not like getting a bunch of leads in through paid, and nothing wrong with paid ads. Honestly, I use them year round, just saying. But my recommendation is, why not start here? This is like grassroots. This is,
And you're talking about leads that have 85 to 95% conversion rate.
Yeah.
I mean, there's nothing more powerful than someone handing out your card and saying, go see this person by the time I see you next, especially a trusted healthcare provider. So they're very high conversion rate for the time, for the money.
Mhm.
And then I was thinking too, a little off topic, don't forget like your local, I belong to the Chamber of Commerce. Even if you don't want to join, go through the Chamber of Commerce directories. There's doctors listed in there. They're usually smaller businesses.
Ooh.
There's psychologists. Go BNI. I've been tried to get to like 50 million BNI networking groups. They try and get you. And I haven't joined personally, but I will go sit there on a Friday night and go through the BNI network and see, are there chiropractors in there? Are there doctors in there? Are there psychologists in there? Are there fertility doctors in there? And it's free. If you're going to scroll on Instagram and TikTok, do that instead and build your business.
Exactly.
Except watch this YouTube video that you're going to do.
Okay. I think we could have a class just on this. Like, seriously, some kind of a course.
Yeah, it's fun.
Just on this topic. I love it so very much. So I could talk to you for hours about this, but I want to respect your time. So any kind of final words of advice or anything else that you'd like to share in our time together today before we wrap up?
Yeah, I just heard I can't think of who was being interviewed, and I apologize, I can't think about it. But thinking about it, like taking time to take action is wasted time. It's wasted action. It's wasted business.
Mhm.
Honestly, don't worry if your stuff is perfect. Don't be afraid. Just get out there and do it. You're
Yes.
going to flounder. You're going to get rejected. You're going to, you're going to feel like a failure to some extent if you don't hear back. One, don't personalize it. But the mantra I use with my clients that I'm going to use with you is doing something is always better than doing nothing. And the more you kind of dilly-dally, does this look right? Is this nice? Is my pitch right? Is my niche right? Is my website right? Are my cards right? Are my colors right? It's all wasted time that you could be building your practice. These things, honestly, a thing of cards is $35. If you mess it, like my first print on these, I had my fax number wrong. The doctor caught it. So now I like fixed my fax number, right? So you just got to get out there and do it. That's my word. Like, do it.
Stop hiding behind your computer.
Yeah,
right?
you gotta read, you gotta live it.
Like, stop hiding behind your computer and start talking to people. Okay. The number one path to getting more clients and patients, talk, right? Okay. I love it so very much. Where can anyone in our audience find out more about you? And also, I think you started to say that, you started to share a little bit more about like the compilation of assets that people can access, I think.
Yeah, yes.
I'm not quite sure what it was, but
yeah. So I'll explain that. So you can find me, Tina Musselman. I'm on LinkedIn. Please Facebook me, add me as a friend. And then my website is profoundlyimprovinglives.com. And
Okay.
I do mentoring, even though it's not up on my website, I do mentoring for this type of stuff. And, but I have decided to take this whole system, because now I'm out talking about it more, and putting it into a course like that you can just purchase. You'll
Okay.
get full step-by-step. You'll get the perspective shifts. You'll get my 3 templates. It's not up yet, only because the person who helped me with my PDF was a little sick for a little bit. But all my stuff is on Well-Resourced. So if you've never been on Well-Resourced, I'm Tina, the counseling dietitian. I have menus up on there. I have elimination diet guide. I have eating out guide. And then this will be a fiber guide. But then this will be added to it, where you can get, I'm going to do like a free download. And then if you want to buy the whole packet, everything will be in there to get going. So, and then I'm always a resource. I love helping and mentoring others. So you can always reach out to me personally as well.
Okay. All right. So everyone got that, and I posted. Did I put the right URL in?
Yeah, that looks great.
Okay.
And I'll send you the URL for the Well-Resourced thing, but it's Tina, the counseling dietitian. That's what I am on Well-Resourced. So,
okay. Excellent.
But please take it and get going. Don't wait. This is the perfect season where we're not maybe as busy, and it's a great time to do this.
We have a opportunity to, just do some things that maybe we wouldn't otherwise, just have the time. So real quick, the other thing I just wanted to let people know is I am opening my calendar. I'm not able to do this on a super regular basis, but I am opening my calendar for a handful of what I call VIP days, where we would work together for an entire day. All right. So I just wanted to let you know that that is happening. If you want to, really start your 2026 strong with a plan, reach out, check out, go to leslievital.com/VIP. Actually, hang on. Let me just share this. Okay. Yep. Straightforward. And, check it out. We can work on whatever is in the docket for you. So we can build out your profit pyramid. We can plan your next launch. We can work on your messaging, right? Whatever it is. So it's a very customizable day. All right, guys. So check that out. If you're interested, let me know. And I would love to have an opportunity to help you. All right. So Tina, thank you so much. This was amazing. And do share any other resources so that we can link that up so everyone's able to find how to purchase the program, your resources, your assets.
Yeah. I'll be happy to share it. So thank you so much for having me, Leslie. It's always a pleasure. And your work has helped me tremendously, and I'm forever grateful for all the growth I had this past year because of you.
Great. I am delighted to hear it. You are doing amazing work. So happy for you, Tina, and your success, and, building this amazing team and just being able to serve more people, doing the work that you love. So that brings me tremendous joy, and knowing that maybe I played a small part in that.
Yeah, you did.
So I love it. Okay, guys. I just want to say thanks for joining. This was such a fabulous conversation. And so next Thursday, so we will have a live stream. It'll be a replay, but we're going to pick a juicy replay for next week and for New Year's. And then we will be kicking off brand new content starting in January. So if you have time, be sure to tune in on, next week. It's a holiday. So anyway, hope you guys have a great rest of your day. Thanks again for joining, and a very big special thanks to Tina for your willingness to share your expertise and all of your wisdom with us on this program. All right, guys. All right. Take care. Mwah. Take care. Happy holidays to everyone. If you celebrate Christmas, Merry Christmas, Happy Hanukkah, all the things, and definitely Happy New Year. All right, guys, take good care. Bye for now.